Okay, so for my fourth observation, I had the opportunity to do a well child sick visit. This patient had previously worked with this provider as well as the parents of this patient. The patient herself was a 2-year-old female who was coming in for painful urination. The patient was screaming before I entered the exam room and the entire time during the exam. This was the biggest demand that I noticed on being able to do my job correctly. Obviously, it was a big distraction listening to a child cry and scream. Next, the child was screaming so loudly it was hard to hear what was being said in the room. The room itself was very small. Both the child's mother and father was there, along with myself and the provider, which made the room feel even tinier. So being able to be in a place that was accessible to anyone in the room who would need interpreting services was the another demand here. Some terminology used was rash, bladder infection, yeast infection, and antibiotics. I did not know any of the patient's medical history here. I mean, the child is 2, so there might not have been a ton. Previously, before entering the exam room, the nurse practitioner informed us that when she was in there, the child was so irate and screamed the F word. The nurse practitioner tried to control her laughter and said that the child was not happy, and she was ultimately surprised that that's what came out of the child's mouth. The provider then responded with she was not surprised because she has previously worked with the patients and knew that that is the kind of language that is used at home. At that moment, I realized this might be a difficult assignment to interpret. Um, the child never had a fever, seemed to be sleeping and eating okay, so there was a lot that the provider had to figure out as to what could be wrong, considering it was hard to do a physical exam on the child. There wasn't any kind of symptoms other than the fact that the child would get upset when trying to go to the bathroom. The provider again here whispered into the child's ear a few times, making that another demand, figuring out how am I going to interpret that if I don't know what is being said. The child, throughout the entire exam, again was screaming and crying. At one point, she had cried for her dad and was passed on to him, where he sat there and bribed the child with candy, books, anything he had to try to get her to calm down. She briefly calmed down for a few minutes until it was time to do the exam. The dad jokingly says that, oh, we know her lungs work. At this point, I'm not sure the provider was overly thrilled with this based on her response. But an interesting thing that I thought was cool but would be a demand for me as the interpreter was the child would not allow the provider to contact her in any way, checking her stomach, feeling her stomach, um, looking in her ears, etc. So, what the provider was able to do was talk the mother into performing the exam herself. She wanted her to pretend as though she was changing her diaper, press on the little girl's stomach, and then they would ask her if that hurt. by this, the doctor was still getting the answer she needed, but also able to figure out what was wrong with the child. I thought that was cool. But what the demand was for me here was, where would I stand in the exam room? Because if a child's laying down, the mother's obviously in front of her, the provider's out to the side, close enough that she could still see what she needs to see. So without getting completely in the middle of that, where do I go about? So in response to the chief complaint, the provider had several suggestions on what to do. First, she wanted to write a prescription for an antibiotic that she could go ahead and start taking if things proceeded to get worse, in case this ended up being a bladder infection. So for example, if there was blood in the urine, a fever, or if the child just continually started acting like things were getting worse, she could go ahead and start this. And they could also try some water and cranberry juice to kind of help heal things if it was a bladder infection. Also, they suggested that the provider also suggested that they take a break from potty training for a week, just to see if it might have been potty training anxiety rather than a bladder infection here, because at this age, oftentimes 2-year-olds do not want to learn how to get potty trained. So that was another concern of the provider. The patient's mother had several questions regarding the child's health. If her weight was normal, questions regarding the antibiotics, and the bladder infection itself, which the provider was able to answer all these questions in a way that the mother understood. In regards to the top 5 demands here, definitely would be the screaming child, some of the terminology used, and ultimately finding the best place to stand in that tight room with all of those people. Some of the physical distractions were all of the people moving about, and obviously the screaming. Interpersonally, some of my feelings were like, was the mother overreacting? This had only been going on for a day. The child was using the bathroom, but there was also potty training going on. So was it the fact the child just didn't want to be potty trained, so she would cry and scream whenever it was time to go to the bathroom? So that was just kind of my internal, I guess, feelings here. So that would be my observation number 4.